Hello, everyone. As on the count of Women's Day, we all experts have come together to talk about the women health matter. Today, a dermatologist, Dr. Renu Nair, psychologist, Dr. Tasneem, and gynecologist, Dr. Shantla, myself, Dr. Priyanka, nutritionist. We four experts are here to talk about the holistic health and how the different aspects of your health matters. I'll start with Dr. Shantala to talk about the gynecological aspects in the perimenopausal and menopausal women. That is one of the most neglected yet most important part of every woman's life.
Hi everyone, I'm Dr. Shantala Tuppanna. I am a laparoscopic surgeon associated with the Sakra World Hospital and Stuti Fertility Clinic. Women's health, especially menopause, perimenopause health, especially starts before the perimenopause age group. Why means when you are healthy physically, psychologically, then you can deal with the perimenopause and menopause. So that is most important for all the ladies. It's not that reach menopause and have a trouble and come and see us. First, maintain your health before perimenopausal age group, especially by keeping your nutrition, health, and family support. These are the main thing which is needed for a woman. And usually what we see as a gynecologist, they come to us first when they are reaching the menopause or after reaching the menopause, especially Indian ladies. Most of them are psychologically not in a well good condition or physically not in well good condition. So the first take home message in the beginning I want to say is be healthy, be physically active, take care of your health as a woman from young age, not at the end, so that you'll be physically fit for the menopause. Especially, we try as a gynecologist, as a skin specialist, psychologist, or a nutrition expert when it is very severe. Not when you are young, please consult us before perimenopause. We will help you in all the aspect. So mainly psychologically and physically, the family support as a husband, as a kids, they should understand. As a gynecologist, we actually treat when the symptoms are very severe in terms of hot flushes, bone loss, or cardiac related issue. Many symptoms they may come: anxiety, hot flushes, skin changes, the knee pain, many changes, period related issue. All these things, when they come to us, we try giving especially non-hormone, non-medical related treatment in terms of psychological or in terms of nutrition, in terms of physical activity. So ladies, first care yourself when you are young, physically fit, so that it will help you to deal menopause.
Okay, moving forward to Dr. Renu. Doctor, there are certain, health concerns as we were just discussing about the hair loss and thing. So, what is your suggestion for our patients? Like, when they are going through, so what are the, definitely we have to take care of the teen girls and, but the menopausal or the perimenopausal or postmenopausal, there are a lot of psychological as well as the lot of dermat related issues comes with the skin. Some people even develop acne, hot flushes, and then gut related issues and hair loss. So I would like to you to please specify in this specific age group.
Yeah. So first of all, hi everyone. I'm Dr. Renu Nair. I'm a founder dermatologist at Dr. Renu Skin and Hair Clinic at Bangalore. So today, as we are discussing about women's health and how the skin changes during perimenopausal and menopausal age group. So skin, most of the aging changes in skin starts around mid 30s. And after 40s is when your perimenopausal age group issues also start. So your skin starts losing the collagen, elastin fibers, skin starts losing the water retention or moisture. So skin becomes dry, dehydrated, you start developing fine lines, wrinkles, and as she said, this acne, adult acne, we usually start seeing around this age group. And about the hair, women may start losing hair, they may start thinning of their hair. So a lot of changes, as Dr. Shantala was also mentioning, happens during this age group. And it is also a lot of psychological trauma to the women, because apart from going through these changes, they also start losing their confidence, because they feel that they have started to age and look much older than their actual age. But as we were discussing, we can start improving these things a little early on. So when you start taking care of your skin, when you start doing a regular skincare routine and hair routine, when you start eating healthy, doing a regular amount of exercise, we can delay these changes so that you don't age faster or aggressively. So you can start aging gracefully. You don't have to lose your confidence. We can improve the skin symptoms by starting a good skincare routine, as well as there are a lot of treatments available which improves your collagen, elastin, gives you mechanical support to the skin, and improve your hair thinning as well. So whenever you are in this age group and you start seeing these changes, please reach out to us so that we can identify these cases and start treating early, so that you don't have to lose your confidence.
And also, I would like you to just suggest the right time. Like, suppose mostly the Indian women start the perimenopausal from. We Indians are the people who are getting the early menopause from 38, also it's seen, or 42, 45. So, what is the right time? Do you say that from the 35 onwards they have to start taking, expert advice, irrespective of whatever screen treatments they are going ahead in advance, or you say that only for the people who are going through certain skin or hair issues they should see the doctors, or matlab, doctors so they can see undergoing the treatments?
A regular skincare routine, especially anti-aging skin routine, you can start in the early 30s, or at least from 35 years you can start. But if you develop certain skin issues like pigmentation or acne, or if you have hair thinning, then that is the right time to come and consult us before it gets worsened. And of course, people don't know that skin gets dehydrated, skin goes through these changes during that time. They might be thinking that it is, I never had any issues, now suddenly my skin have changed. So that is again because of the undergoing hormonal changes. So if you don't know what to do at that time, please do reach out.
Okay, fine. So that leads to Doctor Tasneem, because see all the physiological and dermat or physical changes that we undergo, many a times that women, especially I do remember my mom or my aunts undergoing perimenopause, that the awareness was not so much, but now the people know. Still we are facing a lot of issues, like a lot of mood swings happen, lot of hormonal imbalances happen, lot of we start shouting, like I myself is going through this phase. So we start behaving some weird. So what are the certain techniques or some certain time, like sometimes even if I'm going through some mental trauma, suppose, or some depression or anxiety, people feel ki it's okay, it happens. If sometimes somebody is crying, but they may going through certain other clinical aspect of psycho, and also they need to reach out to the right person. You cannot simply say that, mothers just say it's okay, it happens, or friends say it's okay, don't worry. In the yoga class somebody just started crying, and one of my friend was telling, then all the aunties were saying it's okay, but it's not okay. They have to reach out for the help in order to manage it better. So please just throw some light on that.
Absolutely. Yeah, just like Dr. Shantala and Dr. Renu also mentioned, there are certain hormonal changes, there are certain other changes also that happen in our body, because of which people start, I mean, women especially, start behaving in a particular way. So the way you were behaving, say in your early 20s or in your teens, your behavior changes. And why that happens is because there are changes, like there are changes in the physiological health, there are changes psychologically also, there are changes in your brain chemistry itself. Like for example, see, when we are born, we have parasympathetic and sympathetic nervous system, which all of us know, right? So when we are born, for babies, the sympathetic nervous system is what is more active. That's the reason the sympathetic is known for fight or flight response. So when a baby is hungry, the baby just cries because they don't know any other thing, right? So it's just the fight and flight response that they know. But as we grow older, we start using the parasympathetic nervous system becomes more activated. So that is the rest and digest mode, when babies will be able to start digesting the other things that they take. That's the reason initially, because they cannot digest food, they take more of, they have to take breast milk and all of that, right? So similarly, like how from the sympathetic to the parasympathetic nervous system, the transition happens later as we age, say speaking about the perimenopausal or the menopausal stage, again the sympathetic system gets activated again. That's the reason as we grow older, our women start becoming, okay, it's not just about women, both men and women start having these things, like how we have menopause, we also have andropause for men as well. So similar changes happen in both, but since we are talking about women, I will tell you, there is a lot of anxiety, depression, so many other things that stem in during this menopausal or perimenopausal stage, because again the sympathetic nervous system starts getting activated. So that's the reason we see there is a lot of anxiety, stress, and then again the stress, chronic stress, leads to a lot of other physiological conditions. So chronic stress is not just about getting depression or anxiety or any other mental health condition. It is also about getting so many other psychophysiological conditions, like I spoke about psoriasis, eczema, and even PCOD, PCOS. So all of these things, it is all this is connected. That's the reason we say that a holistic approach for all of these things is needed. So like for example, if a person is coming to me for say depression or anxiety, it is not just about say psychotherapy that is needed, or it is not just a antipsychotic or psychiatric medication that is needed, but along with that it is important to identify what hormonal changes they are going through. So and these days it's not just about a thyroid. When we speak about it, it is an autoimmune condition as well, right? So like we have Hashimoto's thyroiditis, we have Graves disease as well. So at our clinic at Recoup Health also, what we do is we try to identify through the blood parameters, we try to see these biomarkers and try to identify, like I mentioned about systemic inflammation, there is also neuroinflammation, and this neuroinflammation becomes more as we age as well. So there is an age factor to it, but then it's I understand all of us age, but then aging gracefully is what we need to look into, right? So longevity is also something that is important, and that can be managed when we reduce this oxidative stress that we spoke about initially. So it is important to look into the stress management techniques and all of that, and the holistic approach of, like she spoke about, the antioxidants and glutathione that she spoke about is important for mental health as well, because liver detox also happens with that. Cognitive decline also can be reduced through glutathione. It's not just something that has to be taken for skin whitening. It's not just a skin whitening agent as such. So
You shouldn't take
so
it for skin
everything,
skin
whitening. You should
whitening.
take it more as an antioxidant.
Correct,
antioxidant
correct.
and for many other things, because it prevents cognitive decline also to a large extent. So everything, like even the collagen that she mentioned, that also prevents cognitive decline to some extent. So so for many other cognitive many other dementia related conditions, like say Alzheimer's, Parkinson's, and all these things, this holistic approach is very important. So that I would say, especially during the
Insomnia
menopause
is
stage.
also one of the common
Insomnia
issue
is the
that we
most
see.
important thing. So if you have not gotten your melatonin naturally at a very young age, then it starts depleting all of these things start depleting over a particular age group, right? So it is important that at a very young age you follow good lifestyle changes, good dietary habits, and stress management techniques, so that you have this stored in yourself and you can optimize that as you age. So it is important, and then you will start aging gracefully.
Don't you think that is the transition of the lifestyle that we see, that now we
Yes.
sleep at the later hours, and
Yes.
if you see earlier our grannies were sleeping much earlier, and then we at least were going in bed by 10, but now 11, 12, 12, 1 has become a mandate, but a very norm for the
Yes.
next generation.
Yes.
So I would want to ask you, or just suggest our audience that what is the right time when they should seek a specialist help? Where should be that fine line, or they should break that wall that no, now it's not been manageable? Because as doctor also mentioned, ki there are so many other, we nutritionists, we help you with lot of bloating or other seed cycling, and just help you to improve your hormonal balances in the body with the better naturally we can give you antioxidants and all. But still, even after that, if somebody is going to and they do need a clinical psychologist help, what is that fine line that they
Yes,
need to?
absolutely. So sleep disturbances are the most important because it affects at a mitochondrial level itself. So mitochondria, as we know, is the powerhouse for all the body functions, the cell functions, right? And if that itself is disrupted, then there are so many other sleep problems, like there is insomnia, hypersomnia, sleep apnea. So all of these things can be controlled if at a primary level the root cause is identified. So as you
What
mentioned,
stage you expect? Because as a gynecologist, we see patient coming with hot flashes, getting up. That's
yes.
something different. When they frequently get up, they don't. Obviously, any person will lose the sleep.
Yes.
So, as a gynecologist, to where the limitation, I should be thinking and referring to psychologist.
Yeah. So as a gynecologist, like you mentioned, if there is PCOD, PCOS, or endometriosis, so many other things are there,
No,
right?
no.
So
When
you
we come
ident-
to the menopausal
Yes,
hot
yes.
flashes, because PCOS is something which is even early age group.
Yes.
At this level, where we have a menopausal symptoms, where the patient is having insomnia, to consider and refer to you. As a
Yes.
psychologist, the normal layman person also should understand, they should come to
Yes.
you, because many women, I have too much hot flashes, doctor. They don't know to where they have to
Yes.
consult. They will
So
come
after-
to us, or because they should have a common knowledge when they have to consult skin specialist, when they have
Yes,
to
absolutely.
consult a psychologist, when they get so much hot flashes, they won't get sleep. So when they
Absolutely.
should come to you.
So once you've done with your treatment as to whatever you needed to identify as a root cause and all of that, if despite all that, if it is not working, I would say not just after all of those things, at a primary level itself, because all these things get aggravated through stress. So at a primary level itself, as a holistic approach, we need to refer to a mental health professional as well, to see that the stress is reduced at that point, so that the other things are not manifested. Because see, while they are already going through a very traumatic stage in their life, so there could be certain traumatic episodes that could be related, that could be manifested at a later point of time, because for a very long time they must have suppressed it, and later it would have manifested. So during this stage also, when you're talking about the menopause and perimenopausal stage, where they have hot flashes and all, building the resilience is very important. So building mental immunity is something that's really very important, and that at a primary level can be built with stress management techniques. But there could be other things also which are unidentified. So there are undiagnosed generalized anxiety disorder, there is undiagnosed major depression, there is undiagnosed bipolar also, which doesn't have the psychosis element to it, then it gets undiagnosed for a very long time. So these kind of things,
in
when
terms of what you are suggesting, as initially we told,
Initially
as
itself,
a
yeah.
lady, we should maintain health before the perimenopause.
Exactly.
If you have
Prevention
any
is
of
better.
such things, please consult, either skin related, gynec related, psychological related. We should be very healthy when we
Prevention
are
is
going to
always
that
better than
phase.
cure.
Yes.
Yeah.
And then
Absolutely.
when it comes to the hot flushes and all, though, you need to have a lot of fruits, vegetables, and drink a lot of water. So, and get your sleep cycle, get set with your circadian rhythm.
Does
A very-
magnesium supplements
Yes,
help?
does.
There is a lot of
Absolutely,
hype
Pumpkin
yeah.
seeds
on
are
them.
absolutely great. So that is the reason at whatever stage the girls are coming to me, I just make sure that the seed cycling is done. I teach them how to do the seed cycling, as both your phases of the menstrual cycle need a special attention. So if you just fix menstrual cycle, the seed cycle, with the help of seed cycling, do add flax seeds, pumpkin seeds, sunflower seeds, and chia seeds. And there are other ways also wherein we are talking about the antioxidants. So all these things are prepping you up with a better health in order to
Omega-3
deal with
fatty acids as
Omega-3
And
fatty
many
flax seeds
ladies,
and all
one more
other.
important thing they will ask: how much The dry fruit I can have. You are the better person to
So
speak
not
about
more
that.
than, see, there is a limit to all the good fats also. So unfortunately, just because of a lot of social media influence, and that is the reason why we experts have come together to help you with the right knowledge. So it's very important that you see what is your ideal body weight, what is your age, what is your requirement, and especially the seeds, nuts, they cannot be overdone. So 2 to 5 tablespoon of seeds is absolutely fine, based on your requirement, the calorie requirement. At the same time, when we go to up to 5 tablespoon, we make sure that the other fat percentages are very low. So when we do, when we plan the diet, we plan in such a way. When we do the nuts and seeds, definitely nuts, almonds are great, walnuts are very good for the omega fatty acids, your flax seeds are very good. So fish oils are very good if you consume the fish. So all the keralites, those who are having the fishes, also you get the omega fatty acids from there. But then again, you have to be very careful, the cooking oil. So people just forget about the quantity of the oil. When we talk about the which oil, everyone talks about that sunflower oil or olive oil, and then you start frying using the any XYZ oil, cold pressed oil or whatever. But there should be a limit of 5 to 6 ml of oil for every individual who is consuming, because when you are taking the food, you naturally also get a lot of healthy fats. So they are there. Only all these issues are increasing day by day is because of the saturated fat or the trans fat that we are consuming through the processed food. So processed food has to be you cannot just fix that. You are taking a step and taking the processed food, and again then you want to correct it. Rather, you do not take the processed food, and you try to take more of the natural fruits, vegetables, whatever glutathione, whatever XYZ scientific names we take of the antioxidants. You can simply achieve that by taking the colorful fruits, vegetables, a plate full of fruits and vegetables. So 50%, if suppose this is your plate, 50% of it, around 500 grams, you should consume the fruits, vegetables on the daily basis. Now fruits, don't go for the exotic fruits at all. Try to do the best seasonal, locally available food, because then you are saving your body from lot of chemicals, because of which a lot of such the skin issues or the mental health issues or the gynecologist issues are coming, mostly because of the consumption of lot of such chemicals and additives, colors that we are consuming through the different sources.
The same question when the ladies come to me, especially after 40 plus, they won't understand what is their requirement of calories at the age, because every age matters for the ladies, because age increases the metabolism, whole system will be changing. So after 40, most of the ladies, especially doctor, I'm putting on weight. So it's not only your exercise, you should know how much calories, what kind of the amount, and the how much you have to consume. Not only during the perimenopausal age group, postmenopausal also, the metabolism and the requirement of calories will be totally different. According to that, we have to adjust our calories also. Why means after menopause also, if everything is settled, the symptoms are already gone, the menopausal transition, everything has happened, people coming with a postmenopausal related bleeding, other issues also. Because of the excessive fat deposition, peripheral conversion of the estrogens will start. They are again high risk for the postmenopausal endometrial related problem, the bleeding, sometimes the risk of endometrial cancers also involved. So equally, the nutrition is very, very much important when you are aging. So that's why Dr. Priyanka asked to highlight how much they have to change in the food aspect.
Correct. So generally we all the Asian countries, we are like more carb eaters, and that is where all the insulin resistance and a lot of other health related issues comes in, wherein we are filling the plates with mostly heap of rice and putting sambar on that or a rasam on that, or if a North Indian. So if you go to the traditional thalis, you will see there will be lot of fruits, vegetables, and multiple type of they will have some rasam, potassium, then again different kind of palyas, salads, chutneys, which will be meeting all the requirements. I think flaxseed chutney is quite common, right? So that all has vanished and only the carb portion is left, and the protein is something which people give a very less importance. If you take your protein, trust me, your gut will be good, and you will be more content and you'll not have stress. If your gut gut brain axis, yeah, so gut brain is axis is very important. So you do have to take a better combination of prebiotics and probiotics. So prebiotics are basically the fiber which provide a conducive environment for the probiotics. Then taking a lot of curd and other food also, and even if from the childhood we are just destroying it by taking so much aerated drinks and giving it to the children, and with all this super processed foods, ultra processed foods, so they are also causing a lot of harm to the gut, and then finally it is just giving rise to your stress is then giving you a hair fall and other. Even if you do a right amount of, so 0.8 grams to 1.2 grams per kg body weight protein is mandatory. Forget about any other nutrient, just do your proteins correction, and 50% of your day's diet should be a fruit and vegetable. Trust me, many of the problems will be solved in the primitive years as well. As doctor mentioned about the fat cells itself acts as an inflammatory organ, and a lot of inflammatory diets and stuff are being talked about. So we have to get our the preparations done in the early ages, right from the beginning. I think the pregnancy is the right time when we start eating good, and then we start feeding the right food to our children. And once there is a different transition, as doctor mentioned, that it's not only the women who go menopause issues psychological, men also goes. So thank you, this was new information for me. So we have to even take care of the men who are really ignored in all this women empowerment and feminism. So
The thing is, it's important to understand at that stage that they are also going through andropause, so they'll also go through a lot of psychological changes as well because of the hormonal imbalances. So they'll also be in that alert stage all the time. You see that suddenly men change. Those who are very calm at a particular stage, suddenly they start becoming very anxious. They are early to go to a place and early to get back from that place. So all these are signs to understand that they are also going through that transition. So it is important for all of us to understand that, and this at the second level, taking professional help, and again I would say doing all the stress management techniques would definitely help. And like as you mentioned, the gut brain axis, what I would like to say here is it's not just the stress that is maintained at the gut brain axis level. All the neurotransmitters, major neurotransmitters, 80% of them are actually produced in your gut. So be it serotonin, GABA, and all of these things are actually produced in your gut. So if you can supplement, like you can have the proper nutrition required for producing these levels naturally, for the release of natural serotonin, natural GABA and all of that, then you will not have to take any supplements at all.
Kids now don't want to drink buttermilk. None of them will drink buttermilk, but they are more prone to going to the fruit juices. And so we as a mothers, we have to teach them, like it is a integral part of our food system. So we have to give
Fiber-rich
curd rice,
food,
fiber-rich food, at the same time, some probiotics. So as she's mentioning, so buttermilk is very important. So if just giving one small cup of buttermilk on the regular basis to the children or entire family, your gut is sorted. Once your gut is sorted, the stress is sorted. So many a times I even see a lot of patients coming in with different multiple health issues. They start crying all of a sudden. If infertility patients, for that matter, menopause patients, or even somebody who's losing hair, or I can many a times I send them to respective experts, wherein I identify that only by correcting this it's not going to, they are into. So one has to make the draw a line where they identify which is the right person to go. A nutritionist cannot solve all your problems. A psychologist cannot solve all your problems. A dermatologist or a gynecologist. A holistic approach, and yes, self-help is very important. So this brings me to a question to Dr. Shantla also. See, there is a time wherein they are going through all of endometriosis and things, and also the menopausal symptoms are going. So where is that fine line where they have to identify as if this is not normal and we have to see a doctor, or I feel that they should definitely go in advance to the doctors. So what is your take on that? What is your advice?
See, as a matter of the fact, every ladies should have a regular health checkups. Why means many women can't understand is that normal or abnormal. Most of the ladies, even the well educated, I hardly see when they go for health check, they'll be doing blood test, ECG, echo. They're least bothered. They don't know. They are not aware. To be frank,
Correct.
they are not aware. They should have a pap smear. They should have an ultrasound sound where the scanning of the uterus and the ovaries should be checked, and the mammography, breast test, and then a pap smear. These are the routine things after 40 when you're having a regular health checkup. Please include these checkups as a woman. These things should be routine for you. So when you find something, because ovarian related issues can't be seen externally until they form a bigger mass. So regular health checkup should include even ultrasound scanning, the mammographies, and the pap smear. So by doing this, we will have a one basic test where nothing is there. If you have any in the next checkup, if you pick up something which is abnormal, helps to treat. Next thing is, abnormally if you are experiencing something in between, you have to visit. It's not that you should be it's even if it is a mild symptoms, please visit, so that it should not lead to a very severe symptoms, so that it reaches a stage where it turns out to be a different diagnosis.
Correct, absolutely. And Dr. Renu, we were having one session a few days back on the teen health, and then I was just mentioning that it's very important to make it a like a regular health checkup. We go to the parlor activities on a regular basis, and this is my time for eyebrows or whatever activities people are doing, but they miss out on the meeting the specialist. So
Yeah.
a dermat, like if you do make sure that every year, you don't know when all of a sudden you start losing your hairs. You cannot make that. Somebody can lose at start losing at 35. Someone can do at 40. Someone can do even early. So we have to rule out if you're reading out the test. So would you like to suggest some additional test, as doctor mentioned, apart from this, that the women should specifically do right from the early teens?
So, coming to skin related issues, the most common tests that we do are for vitamin deficiencies. So, this can happen even in teens, it can happen during adulthood, and even the perimenopausal and menopausal age group. So, something for hair related, especially, and for certain skin pigmentations and all, we want to do the routine hemoglobin to see whether you have any iron deficiency, anemia. Then vitamin B12 deficiency, which is very common, especially because of the vegetarian diet. Then vitamin D and thyroid. So these are the common tests that we do in most women, especially if they have not done their annual checkup and all that. Apart from that, certain skin disorders, if they come, then we do particular test. For example, women, especially in their 40s or 50s, when they come probably with vaginal itching, some yeast infection they have, or a fungal infection they have, we have to first rule out whether they are diabetic. So quite often they don't do their sugar test, and then they come with a skin infection, and they will be saying that they would have had recurrent infections which they just get treated, but it's never ending. So there we have to do their sugar and their routine parameters. And another common thing is itching. So itching, especially in this menopausal age group, like a little elderly age group, we might initially just disregard it, thinking that it is just dryness, which is common. But sometimes itching can be even a sign of certain internal cancers.
Correct.
So when they come with severe itching, which is not getting better with the regular anti-allergic medications and all that, we have to do their screening test. Correct. And probably we might have to do a skin biopsy also in such cases, and then guide them accordingly.
Correct. And also, doctor, I would want to know from you, like, what is the right time? So, is there any kind of, assessments that they should go? Like, when we did the teen, and that led me to do that session, because I felt that they are undergoing a lot of pressure. Similarly, we all working women, we are like, one sword. We are holding of the professional field that we are trying to ace, and at the same time we have to have another war at home, and with our kids, with our family, with our social life, personal life. So what do you think, and what is your suggestion? What is the frequency that people should go as a preventive health measure? I'm not saying that you
Yes,
wait till you become depressed or get certain anxiety issues and then you reach out. So as
absolutely.
women health, what is your suggestions for that?
So yeah, like as we mentioned, prevention is always better than cure, right? So it is important for the teenagers as well to identify certain parameters among themselves in their peer group also. And as you mentioned, for the parents and all of that, what is it the parents need to identify for teenagers is social withdrawal, sudden disinterest in things. We call it anhedonia in psychological terms, but that is about losing interest in the things they were interested in, and suddenly they become very hyper about things. They are hyper vigilant to things, or they are suddenly reacting to things and all of that. So all of these things, and losing sleep or sleeping too much, because when you're sleeping too much also, there is some trauma that you're trying to withdraw yourself from. So these are some of the red flags, I would say, that would need to be identified either by parents, caregivers, or their peer group, or whoever is involved in their circle. It is important to find out that. And as you also mentioned that there are certain situations where the holistic approach is needed, right? So in these things also, like as you said, after like doctor also said, there are other things like, as you age, there is vaginal itching, there are so many other things that come up, but all these things also have a psychological
Correct. Absolutely.
angle to that, because a lot of itching I have seen is also psychological. So some people have this habit as a habit formation as well. They don't realize that it is not a physiological thing that is, but then what happens is, like for example, something has happened in the past, and the amygdala that has the hippocampus that has stored information, it reminds you that you are feeling that again. Like for example, if there is a wound or something in a particular place because of which there was itching, the brain stores that information in the hippocampus, and that information you get after whenever you are in that position, or you're doing something related to that. It gives you a signal of itching again. So that's not just itching, there are other things like pain related conditions as well, where that information is stored. And then these things get reinforced, and then people think that these are physiological conditions, but these are actually psychophysiological conditions. So once other things are ruled out, then it is important for us to rule in a psychological condition as well. So that's when you can again refer to a psychologist, when you feel that despite all your treatments and all of that, the stress levels are not coming down, the condition is not getting better. Then also you can consult a psychologist. But at a primary level itself, when you see the red flags that I mentioned, it is important to take the individual to a psychologist, because as I mentioned, prevention is always better than cure.
Correct. That leads to the doctor, as we are talking about the menopause or women health. At the different phases, there are different changes in the body, and that causes a different health issues. So, would you like to give some, light on the same?
Prevention is better than cure. Instead of coming to all of us, please take care of your health from the young age.
Correct.
Psychologically, physiologically, if you have any of these problems, go and meet the doctors before reaching this stage.
And like if the teenage is suppose na, like we know that mammogram and all should be done at the 35 plus. So what is the right age that they should start doing specifically, or even the young girls? We don't know nowadays. New studies and new all of a sudden we start seeing different, like for example, when I was studying 20 years back, I never really heard so elaborated about PCOD. When I saw the first case of PCOD, I went back and referred a lot of research papers and textbook, and talked to the gynecologist and other support persons to understand what exactly it is, because that was not so common at that time, how to treat and what are the insulin resistance. Now over a period of time we see so many cases. So would you like to throw some light on the kind of preventions, or the checks that they should do on the early ages?
Early ages, actually, the pap smear, once the ladies are sexually active, every 3 years it should be done until you reach the menopause. And then mammography is not recommended before 40 years. If you have any lump or family history, the sonomammography, ultrasonography of the breast, which is not where the radiation is not there, that's a better option if you have any lumps. Next thing is ultrasonography. Depending on the period related issue, we can start doing early, or depending on the symptoms they can do early. Otherwise the routine health checkups after 40, you can continue the health checkups whatever is needed.
So about PCOD, one common thing that we see in young girls is they come with a lot of pigmentation on their neck, which is a sign of insulin resistance. Even 10-year-olds, 11-year-olds, they'll be a little on the chubbier side. So there we do this insulin, serum insulin levels, and of course the vitamins. And we have to ask them to have a good diet, which is free of all this carbs and high carbs basically, and processed food, junk food and all that, and have a good exercise routine, because most of them are sedentary. So that might help, I would say, a little bit in the PCOD
prevention
correction.
Correct,
Yeah.
correct. So that is what. So you need to have the well-balanced diet, physically active for 30 to 40 minutes every day in the, and even though like the kind of jobs that there are so many teachers or IT professionals in general, because we see a lot of IT professionals in Bangalore, you need to start standing, have the standing desk in order to, do check all your blood parameters and the test regularly. Take care of yourself and your women around. Sleep properly. Yeah, so that's what. So circadian rhythm is very important, to follow the sunset and sunrise. That is I always give this very good example to everybody. Like, we all say that I'm working to XYZ company, and then we refer that in my company it is like this, in my and we all belong to the solar system and we don't follow it. We need to follow the circadian rhythm of sun and eat healthy, keep smiling, take care, bye-bye.